Welcome to Prevea Pints and Pointers. I'm Mike Lemire, the sports medicine manager at Prevea Health. I would like to welcome everyone who is training for the Cellcom Green Bay Marathon and the Eau Claire Marathon. Tonight's topic is to recover like a champion. Joining us tonight is Tom Cron, a physical therapist and athletic trainer for Prevea Health. He is also the Cellcom Green Bay Marathon medical coordinator, and I get to work with him hand in hand with the marathon. Tonight, Tom will be discussing various ways that you can recover quicker from training and races and how to prepare yourself and your body for the next race or run. So I'm going to turn it over to Tom and he'll take it from there.
Thanks, Mike. It's my goal today to educate you and try to help you prepare for some of those distance events you have coming up in the next few months. As Mike mentioned, my name is Tom Cron. I have a doctorate in physical therapy from the University of Wisconsin-Madison from 2010. And I also have my athletic training license and certification from University of Wisconsin-Stevens Point in 2006. So as Mike mentioned, this will be my 12th, since 2012, I've been the medical coordinator for the Cellcom Green Bay Marathon. And we've been out of action in the last 2 years with the pandemic. So I'm certainly looking forward to seeing many of you across the finish line again, and same with those running the Eau Claire Marathon. We're certainly wishing you the best in your training. Tonight's presentation is entitled "Recovery Like a Champion," and we're going to dive into. There's a lot out there. There's a lot of variety in topics I could certainly discuss. So I'm going to try to highlight some of the tried and true methods and some of the more popular items that are certainly available to you as runners. So if you have any questions, like Mike said, just go ahead and put those in the chat and we'll try to answer them as we go on or towards the end of the talk tonight. So before we dive in, I think it's always important to understand the why. As a physical therapist, I have so many patients, they come in, we try to get them to be compliant with a home program. And I think that is very similar to what you as runners experience. It's a long training season. And you need to find that motivation. So I think understanding why is vitally important. So you're compliant with your training, you stick to the game plan, and ultimately you're going to have good results. When that race rolls around. So, big question is, why must we focus on recovery as runners? And whether you're transitioning through some of those longer runs, or maybe you're planning on a fall run, you're probably doing those short distance, mid distance runs. You might be sprinkling in some intervals or some sprint training. Our bodies are experiencing stress. We're burning energy. There are byproducts of as a result of that exercise, and it all takes a toll on our body. We have energy and glycogen, glucose stores that are used up. We start to have electrolyte imbalances, muscles and tendons are strained, dehydration settles in, and the list goes on and on and on. So I think it's important to remember 3 simple R's to kind of break it up for tonight's talk. And that would be rest, repair, and replenish. So I'm going to first start on rest. When it comes to rest, it's the easiest thing we can do for ourselves. Spending time stretching, spending time foam rolling, devoting the time to eating certain foods at the right time of day and drinking, making sure you're well hydrated. That all takes a little more work, but rest is easy. You lay your head down for bed at night and you let your body do the repairing process. And that's super important. I'm guilty of it. I know I should probably be going to bed at 9:30 and I find ways to stay up till 11:30 and really just trying to stick with the regimen when it comes to rest. So, I'm assuming most of you are following some type of training regimen, probably saving your longer runs for the weekend, but it is crucial, absolutely crucial, that Sunday becomes your day off, your day of rest. If you miss a run during the week, you might feel obligated, like you have to play catch up, you have to try to get that extra run in somewhere. Your body needs a recovery, so please do it a favor and give yourself some time off. For those of you that might be doing more midweek, mid-distance runs, you can start to compile those mid-distance runs together back to back, and that's could potentially be a problem for your body down the road. So certainly taking a moment to mix in some of those cross-training days after some of those mid-distance runs would be certainly important. Again, allowing that time for the body to rest. Another portion of rest is sleep. So there was a gentleman by the last name of Lemon. He and his group did a study in 2021, and they basically try to figure out what happens to our body when we don't sleep. And a few things I want everybody to kind of remember. Without proper sleep, our muscle repair declines by approximately 18%. That's huge. Without the sleep, you're not going to get the recovery that you're probably looking for. Our cortisol. So when we talk about cortisol is sometimes known as the stress hormone. It has a tendency to break down our body, break down our muscles. So without proper sleep, that cortisol, that stress hormone, actually increases by 21%. So again, that's certainly not something we want flowing through our body. The more sleep we can get, the more we can reduce that cortisol level. Testosterone, yes, we all have it, we all make it, our bodies need it. Testosterone and growth hormone, they are some of the primary drivers in protein production, and we need protein in our body. Without proper sleep, we can tend to see a decline in 24% of that testosterone. So all these are reasons to make sure you're certainly rested up and sleeping well. When it comes to sleep, I think it's kind of important to understand like when the repairing actually takes place. Our bodies go through these different sleep cycles, and the deep sleep cycle is really what we're trying to encourage our bodies to fall into. So problem is that the deep sleep cycle, it only happens about 10 to 12% of our night's sleep. And our body goes through these phases. Every 90 days, we have the opportunity to fall into that deep sleep. Then we start to come out of it, and then we fall back into it. So it's important. We're trying to have nice, regimented, scheduled sleep that's uninterrupted, so that we can hit nice chunks of that deep sleep cycle, so that repairing can certainly take place. Some of this might seem like it's a no-brainer, but we need to set some routines for our body. We need to make sure we're getting to bed at a set time. We're trying to wake up at the set time. It's important to try to limit naps to about no more than 90 minutes, and especially try not to have those naps in the afternoon or late evening. Avoiding snacking, alcohol consumption, a lot of caffeine, again, towards that late afternoon into the evening, obviously is going to be important. Simple things like not having your cell phone charge in your room where you got that blue blinking light. Those lights can certainly slow and mess with their healing, with our sleep. And then another thing would be just trying to limit screen time before you go to bed. Everybody wants to sit down and watch the news, but if you can try to dial back that sleep time so we're not stressing our eyes, that screen time, excuse me, so we're not stressing our eyes, that's certainly something that is going to help you. Okay, next secondly, we're just going to talk about replenishment. I won't spend too much time. From what I understand, I think it was last month or maybe it was January, one of the Pints and Pointer presentations talked on nutrition. So I don't want to reiterate some of that same information, but there are a few pearls of information that I would like everyone to take home regarding hydration and protein intake. So let's just start with a hydration plan. If you're new to running, hydration is crucial. When I run, I certainly don't drink enough water at work, working with patients back to back to back. And when it comes to running, it's certainly something I need to take better ownership in and setting a nice hydration plan for myself. So these numbers are a little bit staggering when I did a little research. The average sweat rate for most runners is anywhere from a half of a liter up to 2 liters per hour. It's crazy to think that I could sweat 2 almost full liters within an hour, but that is, what the research suggests is the average. It's somewhere from 2 to like 8.5 cups per hour. The sweat rates typically, if you're a heavy sweater and you're sweating potentially over 1 liter per hour, you have a more difficult time absorbing fluid through some of those intestines. So all the more reason to make sure you're drinking at a regular routine, and especially when you're running a race, making sure you're not skipping those water stations. So that some of this might seem a little more preventative when the whole topic is about recovery, but I think sometimes prevention is is what helps us recover the best. So, as we're going through the talk tonight, some of this might be preventative in nature, but they all go hand in hand. When it comes to figuring out your hydration plan, if anybody is at the computer and they have pen and paper available, this might be one of those things you'd like to write down. So if you've never calculated your water replenishment formula, one thing you'd want to do before the next time you go out is go ahead and weigh yourself with nothing on. So this is a nude weight. And then the plan is you're going to go ahead and run for about a half an hour. And during that half an hour race, it is important that you do not urinate, you do not drink fluids during that run. You want to know, okay, you got that set weight right at the start of your run. You're going to go run. And then as soon as you come back, you're going to towel off all your sweat and you're going to go ahead and repeat your second weigh-in, obviously without clothes, without shoes. So get that nude weight the second time. Your goal is then to take the difference and you're going to go ahead and convert that from pounds to ounces. So 1 pound equals 16 ounces. You're then going to multiply that number by 2, and that's going to give you your fluid replacement volume per hour that you need to be taking in order to keep your body at a nice level as far as hydration is concerned. So typical standard fluid replenishment can be anywhere from 2 to 2.5 cups prior to race time or prior to maybe that long Saturday run. And then while you're in those runs, you're going to be trying to shoot for 2.5 to 5 cups per hour, which seems like a lot. That's why skipping those water stations, especially during a race, can certainly be to your detriment. We're going to go ahead and switch gears. We're going to switch into protein consumption. It's important to know the American College of Sports Medicine suggests that about 35% of some of the energy that you're going to burn during a run comes from protein. There's going to be carbohydrates and all these other sources, but 35% does come from protein. So if we're using that protein and which is turned into energy for us, we need to put back what we take. It's no different than filling up your car. You burn half a tank of gas, go ahead and fill it up, put a half a tank back in. So there's just a few simple, again, pearls of information that I would recommend that you take into consideration. Much of that protein needs to be restored within there's some variation in the research, but anywhere from 16 to about 48 hours. So I typically try to stay within the 16 to 24 hour period. And your body likes to see that protein consumption roughly every 4 hours. So we can certainly go ahead and try to replenish that every 4 hours. So let's just kind of run through a little bit of a scenario. I'm going to use my own body weight as an example. We typically know that 0.5 to 0.8 grams per pound of body weight is what we need when we're running, we're doing some weight training, we're doing some biking, we're doing some distance running. So that 0.5 to 0.8 grams per body weight is kind of that number to remember. So if I'm 165 pounds and I multiply 165 times 0.5, or I also multiply it times 0.8, that's roughly going to get me 82.5 to 132 grams of protein per day. So that's what I need within that 16 to 24 hour period to replenish everything. Knowing that I sleep for about 8 hours a day, that leaves me up for roughly 16 hours a day. So if we break that 16 hours into increments of 4, we're left with consuming protein roughly 4 times a day. That's going to be the goal. So if we break that 82.5 down into fourths, that would be 20.6. If we broke the 132 grams of protein down into fourths, that would be 33. So my target of protein every 4 hours is roughly going to be 20.6 to 33 grams of protein every 4 hours. Certainly, like a cup of milk is roughly 8 grams of protein, eggs, roughly 6 grams, a cup of yogurt, 11, and then roughly 3 ounces of meat would be about 21 grams. So certainly you could do Google searches out there. There's a plethora of information as to what foods are how much. But it's something to consider. It's something to calculate. You might find that it's you might be a little bit below where you need to be. And if you're below where you need to be, you might find that you're breaking down muscle more than you'd like. We're going to transition into the repair portion of it. So, when I think of repair, I immediately think of, okay, I need to fix something, or I need to mend something. And that's, to me, it seems like I have an injury, and it needs to be a little more than that. Our bodies go through micro injuries. And so we may not feel pain. We may not feel like we have this large debilitating injury, but we do have micro injuries that you're not even consciously aware of. And we need to go through a lot of interventions to try to keep our bodies in good shape. During a run, our bodies are going through vascular growth changes. We're developing muscle tightness, trigger points, muscle banding, as we call them. We might develop joint stiffness. We might develop asymmetries. Our pelvis might get thrown off. Our spine might be twisted. We all tend to, might go to a chiropractor. We might go to a physical therapist, and certainly try to get things adjusted and back in place. All these things are taking place. As runners, we're very linear. We run straight, and sometimes we may not spend enough time doing strengthening in what we call the frontal plane, or that side-to-side plane. So we can develop muscle imbalances more in the front of our bodies, in the posterior chain and the anterior chain. But we talk about some of these lateral musculature that are supposed to stabilize us during runs. You can develop imbalances. So there needs to be not just a little bit of work on the front end, like we talked about prevention, but then there are also these interventions you can certainly do on the back end to help in this repairing process. One of those things is stretching. We all stretch. At least most of us should try to stretch, and probably do. But there's always a little bit of debate in the research. How long should I stretch? How many times should I stretch? Should I do ballistic stretching, dynamic stretching, static stretching? So there's a lot of information out there, and you'll find conflicting research based on one or the other. But you ultimately need to try what works best for you. If you find that one's not working, maybe try another. If you're not quite sure what decision to make, talking to an athletic trainer, talking to a physical therapist, speaking with your primary care physician, getting some educated information and kind of make that decision. I always kind of think back to high school. We do FIAD class. We'd stretch for 10 seconds. We'd go on to the next muscle, stretch for 10 seconds. And on the flip side, I've seen some research lately that's saying 3 to 5 minutes. Stretch 3 to 5 minutes, 4 times a week. And that's static 3 to 5 minutes per muscle, 4 to 6 times a week. And then sticking with that game plan for 8 to 10 weeks. And I'm not saying that's what you need to follow, because that's certainly very time consuming. If you stretched your quad, both sides, that's 6 minutes, throw the hamstrings in there, throw the calves in there, do the math, it all adds up. It's not overly realistic to have that kind of time. So American College of Sports Medicine currently does suggest 10 to 30 seconds, and then going ahead and repeating that. Give yourself a little rest in between, repeating that for about 2 to 4 repetitions. So in general, we're trying to get over that minute mark, and then trying to do that about 2 to 3 times a week. So I think that's a good rule of thumb, a little bit more doable, and certainly probably the parameters you'd want to stick with. Now, when should you stretch? Should you stretch before you run? Should you stretch after? One thing that is pretty consistent in the research is after we do some static stretching, there is a brief period of time where your muscles do experience some brief, what we call post-stress weakness. So if you're someone that quickly stretches, you throw your foot up on the wall or up on a tree, stretch that calf, and away you go. You're certainly setting yourself up for some potential injury during your run, because like I said, there's just a brief moment of time where your body is trying to recover from that stretch, and it might not have the same strength as it would prior. So I would highly recommend that everybody just focus more on some of the dynamic warm-ups, even hopping on a bike, breaking a sweat, doing some basic slow intervals, but anything that's going to get your core temperature revved up before going for that run would probably be my recommendation. And save that stretching at the end when we really are just trying to let our muscles recover. I'm gonna go ahead and switch cameras at the moment, watching my time, so we're doing okay. I have a foam roller, I have a stick, some kettlebells and some kettlebells and some stretching equipment that I'm gonna go ahead and walk through. I'm gonna show you a three-directional hamstring stretch, the proper way to do hip flexor and rectus femoris, or which would be our quad. We'll stretch that. We will also show a seated figure 4 stretch. And then I'm going to take a little time to show you a few simple joint mobilizations that you can certainly do at home and would be beneficial as runners. So let me see if I can quickly swap over my video. All right, I think we are okay. So let me walk over there and we're going to do a few demonstrations. Okay, hopefully everyone can see me. I'm just going to turn my computer on to make sure I'm in the screen here. First thing I like to do, we have 3 hamstrings, right? A lot of people just go ahead and they stretch maybe one at a time, but we have a bicep femoris, semimembranosus, and semitendinosus. So kind of spanning from the outside to the inside. When we're stretching, a lot of us might want to reach down and try to reach for the toes. And it's not necessary for some of you that might have some chronic back pain. Let's try to keep that back in a more neutral position. And we are going to go ahead and keep that knee locked. Think about sticking out that butt. Keep that chest up. We're going to lean in. So this is where you need to have that discussion. How long do I hold it? Let's stick with that 10 to 30 seconds that American College of Sports Medicine suggests. If you want to target more the lateral hamstring, okay, we can go ahead and put that lateral hamstring closer to the ground by rotating out. Same thing, bending forward, just holding that. If you want to throw a little calf in there, you can certainly pull that foot, pull those toes up towards your shin. You get a little 2 for 1. If we want to hit that inside, that's semitendinosus. Turning in, but don't let your pelvis rotate. You want to try to keep everything square and simply keeping that chest up, sticking that buttock out, and leaning into it. Now, some of you might just hold a static stretch. I'm going to go ahead and just teach you 2 little simple things that you can do. And one is called autogenic inhibition or reciprocal inhibition. Without getting too fancy, all we're doing is when we're stretching, we know that the hamstring bends the knee, right? So when you're in that stretch, what you can do is go ahead and try to actively bend that hamstring and force that heel down into the step that you're stretching on. Hold that for about a 10-second count. And when you relax that tendon or that contraction, you should then be able to stretch a little bit further. We have something called a Golgi tendon organ. I won't get into too much detail, but it's a little mechanism within our hamstring. And when we put tension by contracting the muscle, as soon as you relax, you are going to get a little bit of that extra flexibility, a little bit of that extra stretch. So something to think about. The second one would be, if I'm stretching, I can, instead of firing the hamstring, I'm going to fire the opposite muscle, which would be your quad. And that's where I'm just going to go ahead and do what we call a quad set, where I'm firing that thigh muscle and holding that again for about 10 seconds, and then relax. And when you relax, you should be able to go ahead and lean into that. These muscles talk to each other. Without getting too much detail about our nervous system, the nervous system talks to one muscle. So if we're firing this muscle, it doesn't want resistance. It's going to relax the opposing muscle. So if we're firing that quad, get a little more flexibility and relaxation through the hamstring. And that's ultimately the goal. The next one we're going to do is a seated figure 4 stretch. This is a stretch that is great for some of the posterior muscles of the hip. It's also great for stretching out an area that can sometimes cause some issues with the sciatic nerve. So we're going to go ahead, simple figure 4 stretch. A lot of us tend to just lean into it. But again, it's sometimes about maximizing that stretch by thinking about what position should my pelvis be in. We want to make sure that when we're doing a piriformis stretch for this right side, we're driving this knee down, we're rolling our pelvis forward, and then you can lean into it just a little bit. Everybody always wants to lean forward and feel they're getting the best stretch, but if you go ahead, roll that pelvis forward, drop down the knee, then lean into it, you're going to go ahead and maximize that stretch. We are also going to quick teach everyone the proper hip flexor stretch. Everybody needs hip flexor stretching. So when we are stretching, we need to understand the hip flexor causes some rotation through the hip. So when a lot of you are stretching, you might get in here, you got this really heavy arch in your back, you're really trying to lean into it. That can put a lot of stress on some of our hip joints. But again, let's maximize our efforts by doing what we call in physical therapy a posterior pelvic tilt. Or if you think of a dog tucking its tail, we're trying to tuck that pelvis underneath us. We can then take that right hip, drive that leg outward, and really get some good rotation. Now, I have tight hip flexors, number one, but I can already feel the stretch. And if I sit and then lean into it, maybe do a little reach to the ceiling, that would be a better and proper way of doing a hip flexor stretch. I want to take it a little deeper when we're talking about stretching. Many of you probably stretch the muscle, but there's another structure called nerves in our body that certainly cannot be forgotten. Those of you that have some chronic back pain, let's just say L4, L5 disc herniations, or maybe you have some disc bulges, maybe you got a pinched nerve. Those nerves can be agitated. I always tell people, think of electrical wiring that's running through your house. If we take a razor blade and we cut on that wire, it starts to spurt and spark, potentially causing a fire. And that's not a whole lot different than what's going on inside our body when it comes to nerves. So those nerves eventually innervate the muscle. Well, if that nerve is agitated, certainly the muscle itself is going to be tight. So when we're talking about the sciatic nerve, which comes out of our back, running through the buttock region, and eventually once it gets down to the knee, it branches off into numerous nerves. We want to make sure that we're keeping those all loose. So one thing we can certainly do, and a foam roller is a great way to do it. Go ahead, most of you probably have foam rollers, but go ahead and get your foot up there. Now don't just have your foot straight out in front of you. If you bring it across your body, that's really going to wind up that sciatic nerve, in this case on my left side. Simply tucking your chin, slouching a little bit, and leaning into it is really winding up the brainstem, the spinal cord, all the way down to my back, and eventually winding up that nerve as it exits out into my right. And simply pumping the leg up. Right now, I really feel it because we're tensioning that nerve around behind the ankle, and now I don't feel it. Now I feel it. Now I don't. So when it comes to nerve bloods, generally 2 sets of 15 is plenty, and getting that in, preferably right away in the morning would be appropriate, so your nerve is loosened up for the day, and certainly before you go on that run. We're going to go ahead into a few joint mobilizations. That will certainly be helpful for many of you. So we're all working on stretching and strengthening and getting our cardio in, but we can't forget about joint mobility. So we're going to go ahead and set something up here. When we're running as runners, we need to be able to rock over that ankle bone. And sometimes we develop joint stiffness. I'm going to show you 2 simple joint mobilizations that one can do at home. you have a little step, you have some type of strapping mechanism, might be a yoga strap, might be a ratchet strap that you have in the garage. Anchor it somewhere low. Go ahead and get your foot up on a little bit of a step so that that strap will be pulling slightly downward at an angle. And the place you want to put it is right over the tongue of your shoe. That gets it right over that ankle rocking bone that we're trying to loosen up. All right, so once you're there, you can then start to lean into it. I can feel a really good stretch. I can feel that that bone is actually gliding posteriorly. That's going to increase that ankle bend, or what we call dorsiflexion, and it's going to help with your running mechanics. Now, our feet have a tendency to adapt to different terrains that we're stepping on. So if we bring that knee in, we're getting some good mobilization of that arch as well as the ankle. You'd also want to do the same going up. If you don't have a strap, you don't think that works for you, another option would be next time you're at the gym. This is a 25-pound dumbbell. But getting some weight on the end of your knee and really allow that pressure to get that ankle to bend is another option. And again, popping in and also popping out. But I'll mobilize that ankle. Just a few options for everyone. Finally, we're going to talk about foam rolling. Foam rolling is important. A lot of people try to do IT band stretches. IT band is a common tissue that gets irritated with runners. But foam rolling seems to be the most accurate way and the best way to come up with this thing. So, when we're foam rolling, the goal is to try to avoid rolling over that outer hip bone. It's called your greater trochanter. We have some structures called bursa that try to cushion that area. That's certainly something you want to try to avoid when you're doing your foam rolling. So if you can feel where that little knob of bone is on the outer hip, and then work our way down, that IT band travels all the way down just past the knee. So if we can break those areas up into thirds, maybe 6 inches at a time, that's going to be ideal. All right, so when we're doing that foam rolling that we were talking about, we want to break our IT band up into thirds, okay? And simply search and destroy, trying to find those trigger points. Rolling with heavy pressure can break up restrictions in the tissue, break up the fascia, increase blood flow. And that's ultimately our goal in trying to stretch out that IT band. In school, when we dissect cadavers, a lot of these tissues, they kind of mesh into each other. They're not very distinct structures. So when you're foam rolling, don't forget about your quad, and don't forget about your hamstring. Roll a little bit to the front, make sure you're hitting that thigh. Roll a little bit to the back, make sure you're hitting that hamstring. So those are super important. If you're someone that finds this very uncomfortable, we do have a few options. Many of you might have a stick at home. Again, it's an option where you could put a muscle on a stretch and simply roll it out, working the outside, coming on the back, working the hamstring while we're in stretch position. Things to think about. We're going to go ahead and toggle over to my other table, where we have a few things that you might find in the clinic, a few things that are available to you at certain stores. Okay, we have a few things set up. We have a blood flow restriction therapy system. We have a few tools that we call instrument-assisted soft tissue mobilization tools, or you may have heard of scraping, you may have heard of washout tools. We'll talk about all these. We have a cupping set. There are glass, there are silicone. This is a plastic one. And we also have a few things about dry needling. So let's just start with dry needling. It's something I've done for a few years already. It's something that's very effective. And It is what it is. It's called dry needling. There's no medication being used. We are simply trying to use a variety of needles, which hopefully everyone can see the varying sizes relative to the size of my hand. But it all depends on the body part that we're trying to target. Our goal with the dry needle is to find those trigger points, find those tender spots, drive the needle down through the muscle into the skin. We're trying to create a twitching response. We know when we get that twitching response, it's a great opportunity to stop some of the neurotransmitters that cause us to have such a seized up muscle. Sometimes we use electric stimulation where we'll sit and touch this little point, this grounding wire to those needles. We'll pass electric current through that muscle, getting that muscle to sit and contract in a nice rhythmic rate. It's an excellent way to try to relax some tension in your muscle. Cupping. Cupping is a great way to encourage circulation through the muscle, but also go ahead and try to release tension. So many of you might find that when you do a stretch, you're just not getting the max benefit. If you go ahead and cup, I'm just going to demonstrate this on my arm. When I go ahead and apply some pressure here, some of you might be able to see how my skin has lifted up. Now, I don't have any lotion on, so I don't have the best suction. But when you have that tissue sucking up into that cup, that's stretching. So in an instant, if you had your IT band, you had a few different cups running up and down your leg, that's taking up the slack in the system before you do like a side lying or a side bending IT band stretch. Or you could run cups up and down your thigh before you go into your typical quad stretch. Those are all things that, especially the cupping, that's available to you. You can just go buy that anywhere off Amazon, any stores, Dick's, you'll find that stuff. This tool, it's called a washout tool or an instrument-assisted soft tissue mobilization tool. Many of you might find that you just have, it almost feels like when you're rubbing through your IT band, or maybe portions of your quad, it feels like Rice Krispies on your skin. Simply taking that tool and working in different directions against that resistance is a great way to increase that blood flow, ultimately breaking up some adhesions and allowing that flexibility to improve. This is a blood flow restriction device. It is a device that, when we're talking about recovery, I guess you'd be using it if you're experiencing an injury. Oftentimes when we want to recover, we need to build muscle back. We need to protect our body. And sometimes you just can't put yourself through the strain of heavy resistance. Let's just say we had some patellofemoral issues with our running or some patellar tendonitis. Certainly going to the gym and leg pressing heavy weights may be very uncomfortable for you. The beauty of blood flow restriction therapy is we can go ahead and essentially put a tourniquet system on your thigh. Go ahead and inflate. Go ahead and inflate to a certain specific level. I don't know if anybody could hear that. There's a ton of pressure. What we're doing is we're entirely stopping blood flow, arterial blood flow. Relying a small amount of arterial blood flow into the leg, but we're totally occluding, we're totally stopping the venous return of that blood back to the body. And what happens is we start to cause a breakdown. We start to cause some byproducts, if you will, something called pyruvic acid, which then transfers into what we call lactic acid. Many of you probably have heard that term before, lactic acid. That lactic acid is what eats away at some of the muscle, causes a little bit of muscle damage. And then we can go ahead and with the protein that we're consuming, like we had talked about before, the proper amounts of protein, that goes ahead and builds that muscle back and helps do the repairing process, which we can certainly do. Let's just say a leg press, instead of being 150 pounds or 200 pounds on a leg press, we can go ahead and leg press 12 pounds. We can leg press 25 pounds and get some of the benefits that one would get from heavy lifting. So these are all different strategies, tools, interventions that we can certainly use. To help ourselves in the recovery process. So I know it's a lot to unpack. We talked about a lot. I try to hit various things that are new, some things that are old, some things that are tried and true. But hopefully this gives you a few ideas. You know, we are the experts, your primary care physicians, your orthopedists, physical therapists, the athletic trainers. You know, we're the experts when it comes to this stuff. So if you have questions, by all means, I highly recommend you reach out. We do have, I'm just going to go ahead and switch over to my next camera here. We do have clinics all over the state of Wisconsin, particularly through eastern Wisconsin. We also have western in the Chippewa Valley area. So if you have questions or concerns or looking for a little more guidance, then by all means, please reach out to your sports medicine or orthopedic specialists within your area. That is all that I have tonight. Mike, you want to go ahead and give any questions that came through?
No, I haven't. I don't have any questions that come through yet, but you can all, send them in to the chat and we can answer them if you do have any. While you're doing that, I just want to thank Tom for a great information tonight. Thanks for spending your evening with us, Tom, and sharing some great information. Our next Pints and Pointers will be our last Pints and Pointers for the season. Will be on Wednesday, April 6th. It is yoga and pints. So this one's actually interactive. So we hope you bring your yoga mats and comfortable clothing because we'll be doing yoga that night. So Nicole Norton from the Western Racket and Fitness out of Green Bay will be leading us through the yoga session to help your mind and body prepare you for the remaining of your training. So that'll be on April 6th from 6 to 7. Hope to see you all there. Well, a couple good comments. Thank you for sending your comments in. Tom, do you have any targeted advice about working on the IT band?
I do. I think a lot of people realize that oftentimes IT band pain may not even be from the IT band. The vastus lateralis, there are four thigh muscles, right? And the vastus lateralis is that very outer, that very lateral portion of our thigh that I think often gets overlooked. And it's an area that needs to be treated. It can often mimic what we call IT band syndrome or IT band pain. So spending more time on the thighs, foam rolling the outer thigh, trying some of the strategies we talked about with the stick or some of the instrument assisted tools, coupling will certainly be what I would highly recommend. Sometimes our quads might be fighting hamstring tightness as well. If it takes more effort to straighten that leg when you're striding out on that run and you have a lot of hamstring tightness, that might be firing up that lateral quad and giving you, again, potentially that sensation what we call IT band syndrome, or IT band pain. So it's difficult without knowing what somebody's situation is and what their flexibility is like, what their strength deficits might be. You need to make sure that stuff's all in check. And if you continue to have problems, then reach out to your orthopedist to get a little more guidance on that. So hopefully that answers the question.
Tom, Gary wants to know, if there is soreness, is it better to stretch first or ice first?
I'm sorry, to stretch first or ice first?
Correct. For soreness, yeah, for soreness.
For soreness. I think you certainly, I always tell people it's a rubber band theory, right? I can put a rubber band in hot water, pull it up, stretches a lot easier. You throw it in the freezer first and then try to stretch it, things aren't going to stretch as much. I think the body would hold true in that same regard. So I would say potentially, if it's an acute injury within the first 72 hours, certainly icing and staying away from the heat. But sometimes putting a heating pad on first, or that's why we talk about stretching after the run when your body's already warmed up would be ideal. So I'd probably stretch first and then go ahead and apply that cold that you're looking for.
Well, Again, thank you, Tom, for spending your night with us and educating us a little bit. Again, April 6th will be our next one. So please come on back. Again, like I said, be ready for some yoga and have your favorite beverage ready. All right. I want to thank everyone for viewing tonight, and take care, and we'll see you on April 6th.